First question I had from last week was, what can I do about constant throat clearing? Why is it happening? And how can I get rid of it? So there's kind of two potential classes of things that could be going on here. Obviously, there's probably more than that, but the two main things that I would see on a regular basis in the office would be some sort of allergic response taking place, whether you're inhaling an allergen, whether you're eating something that you're allergic to, a food sensitivity, intolerance, allergy, mold, something like that, causing an excess of mucus production, which is going to be part of that immune response. And this is going to create, obviously with an excess amount of mucus, you're going to start having that post-nasal drip. And if this is the case, we've got to do stuff to dry it out a little bit. We've got to make sure that we're working on reducing that mucus production. It starts with avoiding the allergens. So if it's a food, we've got to get tested so that we can see what those food allergies might be. We do IgG, food sensitivity testing on patients all the time. And we see a lot of foods that pop up that people eat all the time. And when you're eating all of these foods on a regular basis, a lot of times that does create that postnasal drip. Sometimes you'll notice it with certain foods, like you eat a cheeseburger and you've got a big bun and a bunch of cheese and tomatoes and things like that you have allergies to. You get that drip, you eat a bunch of pepper. So there's a lot of different foods that you may notice. I eat this food and I'm having this issue. If it's happening all the time, it's probably because there's a lot of sensitivities that are going on. And when we test these food allergies, we see things all the time that show up that people just had no idea about. For a long time, I had tomatoes, eggs, black pepper, garlic, chia seeds, flax seeds, dairy, wheat, brewer's yeast, bacon. So, like, there's a ton of things that you could be allergic to that you're just eating on a regular basis, leading into that postnasal drip. If it's not an allergy or an inhaled particles or something like that, the other thing that we see pretty often in the office is it could be a sign of reflux. You could have a hiatal hernia or something like that going on. A lot of times we'll get reflux when that valve that connects the stomach and the esophagus isn't closing all the way, which can happen because of chronic low acid levels. It can happen because of a hiatal hernia where that stomach is kind of shifted up. Hiatal hernia, we can adjust that and kind of bring that stomach back down. A lot of the other symptoms that would go along with that can be some of the chest pain. You can get obviously a lot of burning in the stomach, the reflux, the postnasal drip, swallowing issues. So a lot of people who can't swallow pills, that stomach has shifted up. We adjust the stomach, bring it back down, and they can swallow pills again. So that makes a big difference. So that's kind of the other thing that could be going on there. So a couple kind of main categories of things. Now, obviously, there's more severe things. You can have inflammation of the vocal cords and stuff like that. But those are going to be less common. And honestly, really the main thing that we see all the time is just going to be foods that we're eating. And we just got to clean our diet up a little bit, cut some of those allergens out, maybe check the stomach, and postnasal drip and stuff gets a lot better. The other question we got from last week's video, and guys, if you're not watching this live, that's totally fine. I know at the time I go live, a lot of people can't jump on and watch it. So just always drop those comments below. I'm kind of looking at the comments here as I'm going, but I always go back and check the video before the next week's video. So that's where, like I said, that's where these questions are coming from. It's just last week's video. So if you got comments or got questions, just drop them in this video, even if you're not watching live. I'll make sure to pick them up on the back end. And talk about them next week. Other thing here, best supplement for kidney disease. Get this a lot. Kidney disease is actually a major issue in this country right now. I've had patients that have gone from stage 3, stage 4 kidney failure back to normal kidney function if we're using GFR to kind of grade that. The biggest thing is just understanding why are the kidneys getting damaged in the first place. We can't heal the body if we're constantly putting stress on it. The kidneys are subject to a lot of oxidative damage. If we're constantly clearing toxins and metabolites and stuff through the urine, that can damage the kidneys. If we're passing a lot of proteins and things through the urine, that can cause a lot of damage. If there's mycotoxins and molds, some of those mycotoxins can bind to albumin and cause damage in the kidneys. And if we don't have proper antioxidant support. So the question with kind of what's the best supplement for the kidneys is that's a kind of a tricky question. I would say if we just want to generally support kidney function, my personal philosophy is if we want to heal a tissue, we've got to eat the tissue, and it's going to give our body all the nutrients it needs to have normal kidney function. So we have a supplement in the office called blood sugar glandular. Blood sugar glandular has kidney in it. And so that a lot of times just giving your body all the nutrients it needs to support the healing process can be very beneficial. We talk about the oxidative stress versus antioxidant capacity. The kidney is actually powerful enough to produce its own glutathione, which is one of the most powerful antioxidants. If we're constantly pushing a lot of toxins and chemicals and stuff through the kidney and we're creating a lot of oxidative damage, we can override the kidney's ability to continue producing glutathione and we can end up with depletion. One of the supplements that's absolutely amazing for helping to support glutathione production within the kidneys is Rehmannia. So that's an herb we use it all the time in the office. It's very good at helping to modulate the immune response, specifically as it relates to autoimmune conditions. But it can also be very good at helping to support kidney production of glutathione. And then one of the other things is albesia. Sorry, it's the end of the day. My brain's not working properly. We have these little fenestrations in the kidney where the capillaries kind of have these slits in them, which allows this permeability of certain things through the kidneys so that they can be excreted in the urine. And albesia helps to dilate those fenestrations, helps to help us clear things out through the kidney. So my top 3 supplements would be blood sugar glandular or any glandular supplement that contains kidney. Second best would be any glandular that contains liver, Rehmannia, and then albesia. But the key there again is we can't just take something to offset kidney damage. We've got to make sure that we're reducing the thing that's causing the damage in the first place. Blood sugar regulation is one of the biggest things that can cause stress on the kidneys. So if we've got type 2 diabetes or if we've got really high blood pressure, all of that's going to have a really negative impact on kidney function. We've got to make sure that we're supporting those metabolic processes while we're working to heal the kidneys. So my patient I had that went from a GFR of in the 40s up to over 60, we got her metabolically healthy and we worked to support the kidney at the same time with blood sugar glandular, liver glandular. I don't even think she was taking Rehmannia or albesia. We just got her metabolically healthy and it had a big impact on the kidney function. And guys, if you're watching this live and you've got health questions, drop them down there. Otherwise, I'm just going to sit here and talk to myself about some stuff. One of the things I've been talking a lot about here in the last couple weeks is melatonin. The last week, because I think this time last week, they released an abstract. The American Heart Association did that melatonin can cause long-term issues with cardiovascular disease and can actually increase your long-term cardiovascular risk. That's something that we want to be kind of wary of. Now, the whole study hasn't been released. This was just the abstract of the study. A lot of other studies have shown cardiovascular benefits from taking melatonin, at least short term. In this study, it was a retrospective study. It was people who had taken melatonin for longer than a year, and it was people who were dealing with insomnia. Insomnia is another really known risk factor for melatonin, or for melatonin, sorry. Insomnia is a known risk factor for cardiovascular disease. So there's a lot of confounding factors that could be going on. We don't know the dosages they were taking. We don't know what other health conditions they had. But it definitely makes us pause and think a little bit that, maybe this supplement that we thought was super safe and is a very powerful antioxidant and has all these benefits, maybe it's not something we want to take long term. And so I think the key takeaway to be aware of there is that if we're dealing with issues that are causing us to take melatonin every night, if we can't sleep without it, maybe we need to stop and think about what are we doing that's preventing us from being able to sleep? Because the reality is we should not need to take melatonin in order to fall asleep every night. So if you have to take it to fall asleep, the question becomes, why is your body not producing melatonin in the first place? And why are we relying on a supplement when we should just be able to fall asleep naturally? One of the biggest things with melatonin is that melatonin production is suppressed by blue light exposure, which is why it's so important that, as you can see, like right now, the sun's starting to go down. I should be outside watching that sunset. That's going to be one of the best things to help my cortisol rhythm. But removing blue light exposure in the evenings once the sun is set is extremely important to allow those melatonin levels to start rising. So it is something that our bodies should be able to produce on our own. When we take a supplement, we're like mega dosing compared to what's in the actual what's circulating in our body naturally. I was listening to a podcast a couple weeks ago and they were talking about melatonin. This was before this whole study was released. So obviously they didn't take any of that into consideration. But what they were talking about was, number one, the dosage that you need to take a melatonin is extremely low, like a milligram or less. Most supplements are 3 milligrams, 6 milligrams, up to 10 milligrams. You don't need that much. And I think what they had also said, if I remember correctly, was that in a lot of the long-term studies, longitudinal studies that they've looked at the impact of melatonin on sleep, the benefits were more in the elderly population, if I remember correctly, and it was like a net gain of 3 minutes of sleep or something like that. So it's really not even increasing your sleep that much. We just feel like it is a lot of times. Um, and there can be side effects. You can get super groggy if you take it. So, again, melatonin is a very powerful antioxidant. I give it to a lot of people specifically for its antioxidant capacity. I'll give it to a lot of people who have mycotoxin illness and things like that, and they're trying to flush these toxins out of the body. But it's not something that we should rely on long term. Again, if you guys have questions, drop them in the comments below. If I don't see them today, I'll make sure to get to them here on the next week's video. Last thing I want to just touch on here a little bit is red light and the difference between red light and infrared light. I keep seeing it all over my social media as I'm like in my red light era, and it's just people blasting their kids with red light, trying to help support immune system and things like that. And while I think red light is very beneficial, it's not a cure-all that we should just be, seeing these people all over social media using red lights, and so we just need to run out and grab a red light. I definitely don't think that that's a good idea. Red lights have a lot of mechanistic benefits, which means that we understand the photobiomodulation effect that's happening specifically within the mitochondria and the stimulation of something called cytochrome C, which is one of the complexes within your electron transport chain, which is where the body produces most of its energy. So we know that it has benefits. And if we extrapolate the fact that we're stimulating cytochrome C and improving electron transport chain function, we can extrapolate that information to a bunch of different areas. And so we have a lot of this mechanistic data where, we know that if we do this, this would happen, this would happen, this would happen. But there's not a ton of really backed up long-term strong studies that support the use of red light for a lot of these different health conditions that people are touting it as being a cure-all for. If we look at the research, the main research that red light has a lot of strong evidence for is improving fibrinogen and improving collagen, mainly in the skin. So if you're using it to improve collagen and elasticity of the skin, improve your skin health in general, there's a lot of really strong evidence to support that. There's some evidence to show that with alopecia and baldness and stuff, red light can be very beneficial if it's an androgen-based alopecia. Which means that we're probably over-converting into things like DHT. We have a really active 5-alpha reductase pathway. I don't know all the mechanisms of that. I'm not going to speak too much more to that. But I know there is some research that supports that if it's an androgen-based alopecia condition. And then the big thing with red lights is it's going to be more local effects. A lot of really good effects on muscle, tendons, connective tissue, things like that. Compared to things like infrared light, which a lot of red lights have near infrared light in them. And most infrared lights or infrared beds or infrared saunas will have mid, near, and far infrared. So there's a lot of crossover specifically with that near infrared wavelength. Biggest thing is infrared light penetrates deeper into the skin and it's designed to heat your skin. It's coupled with heat a lot of times. It's affecting your body differently, more from a circulatory standpoint, from a cardiovascular health standpoint. There's going to be some crossover with inflammation reduction. Typically, when you're doing infrared light, it's going to be more whole body. Red light's going to be more acute localized. Perfect example, I use infrared light in the infrared sauna all the time to help support recovery, stress resilience, parasympathetic activation, detox pathways, all of that stuff. I use the red light at home more for acute injuries. I've got a knee issue going on right now, so I'll put the red light over my knee to help speed up the healing process there. And then the other important thing we've got to consider with red light is there is a biphasic reaction, which means that if we don't do enough of it, it's not going to help us. If we do too much of it, it's also not going to help us, and it may make things worse. So we've got to be really careful with how much we're using it. So I've got a video all about red light and infrared light that's going to be coming out on my YouTube, should be this weekend. So if you're not subscribed and following my YouTube, Dr. Connor Wolfe, go follow that. I've got a bunch of kind of cool overview, science-based videos out there that talk about cold plunging, infrared sauna, red light, sleep, exercise, all that stuff. You can go check those out there. And like I said, the video talking about red light versus infrared light will be posted this weekend. I've got another one about infrared saunas that should be posted in the next day or two as well. And I also always post these AMAs to my YouTube as well. So if you miss it, you can always watch it there. But I hope you guys, as always, are having a great week. Hope you have a great rest of the week. As always, if you watch this, thanks. Drop a comment. Let me know you watched it. Let me know what health questions you have. My goal is just to help educate people so they can make the most educated decisions for their own health as possible. So I'm always here to answer the questions that you guys may have. I hope you can use me as a resource, and we'll catch you guys on next week's AMA.